Hello there, my name is Alex. Once again, I'm here with Intrepid Defense, and today we're going to go over IV starter kits, little saline lock kits. I got 4 of them sitting here in front of me. This one here is a personal one that I make from all the individual pieces put together, and then I got 3 other ones here that are from industries. So I got Curaplex, you can see here, comes in this vacuum sealed package. I have Mojo, which is a bigger one, more bulky. It's got some more stuff in it than the rest of them. And then I got the NAR IV saline starter kit or saline lock kit. We're going to rip through each one of these, and we're going to go through and kind of see what they have and see what is cool, which one's not, which one's kind of fluff, and which one's good. To break down, just to start, the NAR kit is roughly around $12.49 if you were to buy it online for yourself. The Mojo saline lock is about $14.29. And then the most expensive one here is Curaplex. You're looking at about 23 bucks. All right, so we're going to break down all these individual kits. First things first, we're going to go through the NAR saline lock kit. I'm going to rip this one open and see what it's got in there. So I do like this one. I use this one from time to time. We get them at work all the time. They're relatively cheap for what they got. The biggest downfall to these is I don't like these style 18 gauge catheters. I'm a big fan of the wing. I'm not going to pop them open, but the reason why I don't like these ones tend to stick. The catheter tends to stick on the needle. I'm not a huge fan, but I do like that they give 2. I'm a huge fan of having multiple things, as I had in that different kit video. I like having 2 of something, because one is none, something happens, Murphy's tend to hit. I like how it comes with an 18 gauge needle. Always need a hard needle. And this is a needled port, which I'm a big fan of as well. When I get into the video making an IV and how I set mine up on a person, I'll show you why it's really important to have a needled PRN versus a needleless. Also comes with a 10cc syringe. It's really good for drug administration. And then this is that Raptor securing device. It's essentially a little piece of Velcro. I'm not a huge fan of it. I'd rather use tape and other stuff like that. This definitely is, it has like a rubber bandy style portion here. Not a huge fan because it's this huge mangled thing. You don't have a whole lot of securing to it. So I don't actually use those. If I ever rip this open, I use tape. Also, this comes with all-purpose sponge, like a little 4x4 gauze. Pretty nice. It's nice to like damp up all the blood. If you made a bad stick or whatnot, this is your device to go over top of the IV whenever you're finished. And then obviously you have your constricting band here, and then 2 alcohol preps. So overall, not a bad setup for, especially how vacuum sealed this is and little it gets. You can fit this in like a little 5.56 pouch, any kind of like GP pouch, anything like that. But overall, this is kind of what you're getting here for $12. It's not a whole lot in here. You also don't have any kind of tubing to actually start. So if you had, now you had to get tubing from somewhere else. So this is the NAR saline lock kit. All right, starting off here, the second IV kit that we have is called the Mojo intravenous starter set. Now, as obviously you can see, this is a little bit bigger. It is vacuum sealed as well, and it comes in a bigger package comparatively to the NAR kit. So now you're looking at like space inside of an aid bag. The smaller aid bags that people were running, especially for different mission sets or whatever your job is, like this is starting to be one of those things where it's like, I don't know if I can fit this, or at least a couple of these in there. So, all right, strip this thing open, see what's inside. So right off the bat, you can see there's more shit in here, which is good. I'm a big fan of more stuff, but I don't like the packaging. So obviously we have our constricting band here, which is nice. This one comes with a 20 gauge catheter, which is nice, especially for children and like older individuals or different stuff, the harder hitting veins, you know. And then you have an 18 gauge. Then you have a needled port, which not a huge fan of. You got a 5cc flush, which is nice. Would love to see a 10, but 5 I guess is there. You got a little band-aid. I don't know if you even need that, especially for if I'm doing an IV on somebody. I'm not really looking to put a band-aid on it, but you got some alcohol prep, iodine. You got some little 2x2 gauze, and then this is where you're making some good money. Is you got your film is going to go over top, and then you also have an IV tubing, which is nice. This is a 10-drop set, which is cool. Obviously, you got a little bit more in here, but like for the bang of this packaging, you could absolutely make this smaller, like prefabricated from the factory. I think personally, like the bags that I make have a little bit more than this in there, and it's a smaller overall size, so it fits in pouches better and more ergonomic. But overall, not bad with my stuff. I do love getting a 20 gauge syringe or IV needle, as well as an 18. I would love to see 2 though, just because once again, 1 is none, 2 is plenty, right? You never know what's going to happen. You never know if something you poke or stick or fall or trip and now your needle's gone, depending on what your job is, right? I work in a lot of environments where in a vehicle or doing different things in really dirty environments, and if I only have one of these items, now I'm really up shit's creek without a paddle. So cool, that was the Mojo IV start kit. Let's put that to the side and let's get the next one. All right, going through the Curaplex. This is a vacuum sealed package once again as well. Overall size, you can crumple this thing down into pretty little, so this can fit anywhere. It's relatively flat. That is because it doesn't have near as much as some of the other one does, but this thing, size-wise, coming off, like if you're trying to put this into like a general purpose pouch or into a pocket or something small, this one does a really good job. But once again, it is $23, so let's rip this open and see what we got inside. So overall, just from the get-go, this is like really thin plasticky material that you can rip through. So if you're doing something relatively like rough on your kit, that might rip inside there, which is not good. But all right, here is your film. It's going to go over on top of your IV once you get it done. Your Tegaderm. We have a pretty decent sized. So this is Penrose drain is what they're going to give you. So that's going to be your constricting band, which is pretty good. I like that. It's very durable. It's not going to rip. Comes with two 18 gauge needles, which I do like these ones a little bit better. These ones come out. Very familiar with these guys. I like this brand a lot. I even like the ones even better that have little wings on them. But these are good. Once again, I like having two. Here's your little 2x2 for cleaning up their mess. You got your little alcohol prep pads, 2 of them, which is nice. Then you have a needleless, this is needled. And you have a needleless, which I like giving the ability to do both. And it also comes with a standard hypodermic needle, 18 gauge, right? I'm a huge fan of that. I like this overall setup. It's very slim, but it can fit in a lot of different spots. And I like the ability to have two. I like to have needled and needleless. The reason why I'm not a huge fan of needleless is it's a pain in the ass, especially when my hands are all slippery, been sweaty, doing all kinds of stuff, especially as a paramedic and a tactical paramedic, as well as a special forces medic. Like, it's very challenging, the environment you work in, especially at night, to try to get the IV portion and the needleless PRN to connect up to each other in the dark at nighttime. So big fan of having a needle. All I gotta do is just find the hole, get the needle inside there, tape that down, and it's good to go. So overall, this is a lot of bang for the buck, but once again, this is $23 compared to the other two, which are sub 15. So think about that whenever you're making your purchase on these. All right, so the last one I have here is my own personal one that I make from all the individual pieces put together. So rough estimate of cost on this, it's probably sub $10. The reasoning why is, where I work, I'm able to purchase the actual materials themselves, like the individual IV needles and individual drop sets and whatever else, and it comes in a huge bulk box. So obviously buying bulk, you definitely get better bang for your buck. So if you're in charge of like your units or your place of employment's work, this might be the better option for you, because you can order exactly what you want and you can order in bulk and set up your own little kits. Because realistically, what people do anyway is they rip these open and take what they want and then set up their own kit that way. But I digress. Going back into it, this is a 15 drop set. It's an 80-inch securing locking drop set. 15 milliliter of a drop set. I like these because I can get these really tight, and I'm not going to mess up the integrity of the actual drop set itself, and I can put that in a little tiny bag. All right, laying these out. Once again, I talked about the little winged 18 gauge catheters. I have 2 of them in here. Really enjoy these. I like them a lot. Worked with them a lot. I have a 10cc syringe for drug administration, especially when it comes to like TXA. And then I have a needled port, our PRN, an 18 gauge needle for both drug admin and as well as utilizing the line to connect up to that needle port. I have also a 10cc flush. And then I have 4 alcohol prep pads. Never know what you're gonna need them for, especially adding different drugs into the mix. I gotta clean off the PRN and do all that stuff. And then I have my Tegaderm. So when I set this up, it doesn't come prefabricated into a little bag. I get my own little tiny baggie. You can get these at any giant retail store. They're relatively cheap. You can get boxes of 250. So I kind of set up everything inside the Tegaderm, lay it in here, and try to get it to where I can roll it up on itself. The reason why I do that is because when I roll it up on itself, one, I can use this Tegaderm to wrap it around, and then it protects the integrity of these pieces on the inside, and it gets relatively small. So I can get this in here, fit this on this side, sits on that side, and I can get this over here, roll this up, Put this in here. And now, I can seal this up. Squeeze all the air out of it. And if anything, I could rubber band this, and now it comes through. It's the same size as this NAR, and I also have tubing in here. And it's water sealed and stuff like that. One thing also too you can add is making sure you add a IO, easy IO. You can toss this in here, and now you have 2 different ways to get access. One thing on the end you can add to your own is you can add IOs. So I'm a big fan of these IOs. These are the easy IOs. These are technically supposed to be used with the drill. The drill would connect up back and it would drill it in, but you can use your hand for this. I've done it on both multiple different sites. The only site you can't use this obviously is the sternum, but this is really easy, really nice. You can fit this in here as well, and now you have 2 different ways to get access onto a patient and one simple kit, and relatively cheap comparatively to the other things, especially if you're buying bulk of those. You don't really get a good discount. So this is all food for thought, guys. Please let me know what you think. Tell me if you want to see more or less, or if you want to see different videos. I'll have more stuff coming out soon, especially medic related. Already on the channel is a bunch of stuff related to guns. So thank you for watching. Thanks for tuning in. Always like, subscribe, and then let me know in the comments of what you would like to see. Thank you.